Oh, and good afternoon, everyone. Welcome to the Women and Girls Research Alliance January panel. We are so excited to have you with us this afternoon. We are having a discussion on girls, technology, and the social determinants of health. And we are expecting a robust and rich discussion today. I am Dr. Michelle Meggs, and I serve as the Executive Director of the Women and Girls Research Alliance. And I have to tell you, this panel today is absolutely exciting. And I am going to turn our panel over to Sonja Gantt, who will serve as our moderator today. And she will introduce our panel for this afternoon. Sonja?
Dr. Meggs, thank you so much. Thank you to your team as well for the invitation. And I'm excited to be able to facilitate this conversation. I think the impact of this pandemic, as we know, is widespread. And many of us, even if you do not have school-age children, have certainly heard about the challenges that are facing our children. As Dr. Meggs shared, our topic for today is girls, technology, and social determinants of health. And I think we can all agree one of the recognized social determinants of health is the quality of your education. When we think about during this time how much of our instruction really for a majority of grade school children in our area has been remote, outside school buildings, the access to technology is more important than ever. As the executive director of the CMS Foundation, and for all of you who've never heard of that organization, it is the nonprofit fundraising partner of Charlotte-Mecklenburg Schools. I want to share with you that since this pandemic started, much of our focus has been on ensuring that all children are able to access the instruction provided by their teachers and also the continued connection with their classmates. I can't start this without saying a big thank you to the community of Charlotte. And that's individuals, corporations, organizations. We have garden clubs, PTAs, as well as our public entities, the City of Charlotte and the State of North Carolina, who recently helped us reach a fundraising goal that means that CMS is able to provide its students with a year of internet access. So far this year, nearly 12,000 mobile hotspots have been distributed to our children to make sure they can stay connected to their education. Now, we all know that the hardware is just one piece of the puzzle. It's a very small piece to make someone truly connected. And that's some of what we're going to be talking about today. I'm excited to have today's conversation with three panelists who I will say, and I'm going to tell you all about their credentials, but above all, what you need to know about these people is that they care deeply about children. And they've spent their professional lives trying to make sure that children have what they need to become the adults that we want them to be. So please join me in welcoming, first of all, Dr. Cortney Anderson. She is the CEO and founder of Bilingual Brown Babies. It's a specialized service for families of color who, as she says, are serious about raising their children bilingual in English and Spanish so that they will be able to maintain footing in an increasingly competitive global workforce. Dr. Anderson has worked overseas in relief and development, but she has also been a grade school teacher, and she's been a college professor since 2005. She received her bachelor's degree in Spanish from Spelman College, her master's degree in international affairs and interdisciplinary studies in international communication and anthropology. That's a mouthful, Dr. Anderson. All of that came from American University, and her PhD in communication and culture from Howard University. Welcome. We are delighted to have you joining us in this conversation. Dr. Frank Barnes is the Chief of Equity and Accountability for Charlotte-Mecklenburg Schools. And during his tenure in CMS, he co-authored the report entitled Breaking the Link. It's the school district's equity report. Prior to Charlotte, Dr. Barnes worked in a similar position with Boston Public Schools. He served there as well as the Chief Accountability Officer. While he was there, he led the design and rollout of the district's turnaround strategy for its lowest performing schools. In a previous role at the Annenberg Institute for School Reform, he worked with districts across the country on how to improve their schools, and his research has focused on knowledge management and adult learning in organizations. Dr. Barnes hails from the city of Chicago, proudly from the South Side. He has a Bachelor of Arts degree in political science and speech and communications from Macalester College, as well as 2 master's degrees in teaching and curriculum and education policy and management from Harvard University. He earned a doctorate degree from Harvard University's Graduate School of Education as well. And last but not least, Dr. Cortney Harris, welcome. She is the Executive Vice President of Education at Junior Achievement of the Carolinas, and she credits growing up in Aliquippa, Pennsylvania and Rochester, New York, with teaching her the very unique lessons she shares through her work in education and with young people. She's a passionate community advocate with 20 plus years of experience in nonprofit and educational leadership roles. Prior to Junior Achievement, she's also worked with Strive Together, United Way, Uncommon Schools, and Monroe Community College. In each role, she says she consistently and successfully advocated for equitable youth opportunities and access. Cortney's earned a bachelor's in sociology from the State University of New York, Albany, a master's in youth development from Clemson University, and a doctorate in organizational leadership from North Central University. I feel surrounded by some tremendous scholars today. Thank you all for joining us and being here. And let's get started. As our audience heard Dr. Meggs state, please be sure to put your questions in the chat, and I'm going to do my best to integrate those into our conversation, because we do want this not to be, as the children say, a sit and get, but really a time for us to all think about ways to support our youth. Dr. Barnes, I'm going to start with you. If I can ask you to go back almost a year, hard to believe it's been a year almost, but go back to that second week in March. I believe it was March 16th when school doors closed, and give us an idea of what school leaders in CMS really began to think about almost immediately.
Surely, and thank you very much for having me. Many of us might recall that back in February of 2020, we all were getting acclimated to what was this coronavirus, COVID-19. We began our plans in earnest in early February, trying to think about what would things look like if we had to go remote. At the time where the governor declared that schools would close across the state of North Carolina, we were already 1-to-1, meaning there was one device for every student in grades 3 through 12, but we didn't have 1-to-1 devices for students in K through 2. So we really had to develop 2 systems, kind of a paper-based educational system for distance learning and a computer-based system for distance learning. We also have the majority of our students, not all, but a majority of our students actually rely on us for meals during the day. They're eligible for free and reduced price meals. So we had to think about a food distribution process, one that would allow students and families to be socially distant, but would allow them to have access to food that we could provide throughout the community, not just in one location, but in literally dozens of places. We had to think about the whole notion of digital inclusion, which hopefully after our conversation I can talk a bit more about, and think about elements of digital inclusion, which we've all gotten more acclimated to. And we had to think about how do we actually get our teachers situated to going from just being conversant with digital tools to being exclusively reliant on them to convey information, concepts, and engage their students. And we had to do that all in a very short period of time. I think where we started last spring and where we started the school year in August were in 2 different places. But I think all of us had a shock to our proverbial systems. I think the last thing I'll say before I leave things on to the rest of the conversation is we realized just so poignantly how we as a school system are situated in a larger system, whether it be in our county, our state, or our country, where there are vast disparities. And we were situated as a public sector organization, a school district, trying to stand in the gap between those who had the resources that we would expect the average resident to have and those who did not have those, and trying to mitigate against those equity differences, which for some people were the difference between education and not education. And as we're finding now, almost a year removed, for some people could be life and death. So we were seeing ourselves as advocates for all of our students, but we're trying to use the resources we had. And I think, as you've articulated, you began your work during that journey to help us to bridge that gap even more.
Dr. Anderson, I want to bring you in here because you work with families. And as I mentioned earlier, the hardware is one piece of the puzzle. And as you heard, CMS was actually in a better place than many districts across the country that had not made those investments in hardware and weren't ready yet to even send a device home. And as we know, in the same way that grocery stores were seeing a run on toilet paper, I think the suppliers were seeing a run on those Chromebooks, on iPads, on hotspots. It was tough. But I know you are very passionate that the hardware is just one part of it, and that the soft skills, and you heard Dr. Barnes refer to making sure that our teachers were ready to deliver instruction in this way. I want you to jump in on how important those soft skills were and what you've seen with families.
Yes, and again, thank you so much for allowing me to be a part of this panel. One of the things that I know that I see, and I see that a lot looking at it from an international communication perspective, is this whole relationship between communication sources and resources, access, and then the ability to be able to have the knowledge associated with it. And one of the things that I've seen in working with the families that I work with homeschooling and those who are doing virtual, who have moved to a virtual platform, is that having the access to the hardware is phenomenal, but being able to troubleshoot when things go wrong, being able to have the support when technology doesn't work quite the way that it does, understanding that you can't just bang the hotspot in order to get it to work. And those types of things really kind of further exacerbate the divide that we have. And I know a lot of times we look at our children as these digital nomads. And I think a lot of times that moniker is almost misappropriated to them, because yes, they have access to technology, but we don't necessarily provide them with the skills that they need in order to successfully manipulate that technology. In being able to work with, especially our girls, because our girls are the largest group of tech adopters. But if they don't necessarily have the skill set that is associated with it, there's still this gap in terms of how they're able to use these technologies successfully in a way that actually speaks to their achievement. So one of the things that I look at a lot is being able to make sure that there's a way for them to be able to have self-efficacy when it comes to access to technology. So it's not just having the Chromebook, but being able to know what to do when the Chromebook does not work. What happens when you lack connectivity? What do you do? How are you able to use your actual verbal voice in order to be able to get access to the technological voice when things go wrong? And that's really important to show that connection between those two.
Dr. Harris, chime in and bring us the perspective of a nonprofit that works strictly with young people. You all, this had to disrupt things a little bit for you all in the beginning, and give us a view of how you've adopted some of your services to continue to engage young people.
Thank you, and thank you for having me. At Junior Achievement, we partner with schools, so I can echo the point of CMS being better prepared than other school districts around the country, because we were able to pivot pretty quickly and do a lot of pilot virtual work with CMS almost immediately. Within a week of us shutting them shutting their doors, we had to shut our doors, but we were able to because students had technology at home, we're able to partner with them to give them our same curriculum. This curriculum hasn't changed. It's the same curriculum, but we were able to create PowerPoint presentations where we would normally do things with paper. We were able to create a digital platform and not miss a beat, because CMS had prepared those lower grades with the pieces of technology. But what we can say is that, similar to what Dr. Anderson said, the troubleshooting, right? It was, okay, I'm on the phone and I am now becoming a program administrator saying, okay, honey, can you try this or try that with your hotspot? Unplug it and plug it back in. I'll let you back in. You know, and trying to be that tech support that all of us need, even when we're at work with our colleagues, trying to be that tech support. So I do echo that, and all of our programs now are virtual after 100 years of in the classroom experiential learning in our facility, in our capstone facility. We had to really quickly make a decision with but the only other alternative is not serving students at all, which isn't an alternative, which isn't an option, right? So we just quickly pivoted to say, wherever our students are, especially with our largest school district, CMS, wherever they are, that's where we want to meet them. We want to meet them where they are, but we also want to provide support because we know that, you know, 140,000 students is already, you know, such a broad base of, you know, the haves and the haves of support and the haves of technology and the haves of the devices and the haves of parents that are there to help. So how can we bridge that gap to say, when we are offering services, we have to make sure that we also have a staff person there that's going to be able to walk them through how to do it, so that there's no tech shaming and that going on. So I think that I'm pretty proud of our small team with only 4 of us that are looking to serve these students. But like I said, the only other option is not really an option, is not to get the all of that support into the hands of the students who really need it in this opportunity, this year of opportunity is what I'll call it.
I like that, a year of opportunity. I want, and any of you can grab this, but as you were talking, it occurred to me that one of the things we've all had to learn, and I'm saying all of us because there are many adults who are working from home, and we've experienced when the internet becomes unreliable and been dropped from a meeting, and how frustrating that is for grown people. So the level of persistence that is required of students, I'm just curious what you think about the impact of that sometimes on the desire to engage when you may be distracted by what's going on at home. And I think I'm going to put this to Dr. Anderson and Dr. Harris, because in addition to your professional roles, I know that you have school-age children who are learning remotely. And I think Dr. Barnes, you are with me. We have adult children now, so they've left us. Although persistence is probably just as important for our college students as well, right? But for our youngest students, just talk about the impact on the desire to learn.
I'll start with that, because one of the things, like going back to that conversation about self-efficacy, like being able to teach our children how to advocate for themselves is something that we're doing anyway as parents and as teachers, right? Making sure that they know how to speak up when they need something, knowing how to ask the right questions to get what they need. And that added layer of technology and technical support can a lot of times bring a lot of frustration, especially to our smaller children. I'll use my twins as examples. They're 7, they're second grade, and a lot of times they're fine if everything is working well. But the minute one thing goes wrong, it can lead to a meltdown, right? And being able to work with them through that particular emotional support that they need, but then also getting them to stay consistent and persistent can be a challenge for parents that are working from home. But if you have your child in a daycare and they're doing their classes remotely at a daycare, what does that support look like for them? How are they able to get through? And I like what Dr. Harris is saying in terms of this idea of tech shaming, because sometimes in frustration, even with educators, there's this it's not necessarily intentional, but we do have, in terms of being able to move efficiently, there might be some aspects of tech shaming that can also silence the student in the classroom. And how are we able to address those sorts of things? How are we able to address the background noise that they might have because of family members and this, that, and the other? I have 5 that are on the computer, including myself. So how are you able to work through them all being in class at one time, or one person having a meltdown, or this parent being able to correct a child because of something? All of that comes into play, and it does impact how the children start to learn self-censoring. when it comes to their needs and being able to advocate for their needs in the classroom. And that is just something that I do. I mean, I work with it as a parent, but then I'm also trying to encourage educators to be able to take that into consideration too, when they're dealing with their students in this virtual classroom environment. I don't know if Dr. Harris, if there's anything you want to add to that.
I would say, in addition, a lot of our assumptions are based on a baseline of having support. It's not based on the lowest common denominator of no support, of being in a learning pod. It's really based on having some level of support to help them navigate. But think about if their parents have a disability, right? Or their parents aren't there, or they are in a learning pod, or they are not. They don't have that baseline. And then every time my husband and I discuss it, we say, oh my God, we're so fortunate to be both working at home, to be able to work with my 8-year-old. But that is what I think we need to start thinking about, the digital divide, giving them a device, but then what are the assumptions that have to go along with that? Are we assuming that they have a home? Are we assuming that they have X? Are we assuming all of these assumptions? Because if we do that, if we're looking at it more holistically, to say we have to assume none of that is there. If we're able to capture all of the support necessary, we have to assume that none of those are there, because if not, we're going to leave out a chunk of individuals, students who don't have that support system, and have to be self-advocates and have to manage this and go through that frustration, all while still having a desire to come and learn, and a desire to come, but to come in and smile and turn on their cameras every day and engage and put the answer in a chat box, right? That assumption. And it is not a forever, but turning it around to this opportunity for them to, like Dr. Anderson said, have that self-advocacy when they're back in the classroom, when they don't understand, or the teacher is going so fast, or any of those things, they're able to raise their hand and say, I need help, or can you slow down, or can you repeat that? I think is the opportunity that we have, and that resilience that Dr. Anderson in our pre-meeting talked about, is that resiliency, but then also the soft skills and the skills that Sonja asked us about, like the soft skills that they are also growing as they have to maneuver through this opportunity year.
Dr. Barnes, I want to bring you back in because I remember at the beginning of the year, our technology team within CMS had set up a hotline where parents could call in. Can you talk about some of the efforts to support both students? Although I know that you also understand the challenges of even adult learning and supporting our teachers who may not have engaged with technology as much in the past.
Sure, we really had to create a nested hierarchy of support, where we were coming up starting with the students and who would be the support for students and families, and then who would be supports for teachers and administrators, and then who would be the support and what types of support. So we had levels of support around learning our technology tools. On March, I think it was 11th when we left, every school could choose some of its own tools. There wasn't a system-wide platform that was required. So you had a decentralized system with decentralized supports. And as Dr. Harris and Dr. Anderson mentioned, just like students work, you expect a certain level of support and capacity at a family, you're also then are expecting that at a school. So we had to level out our supports and say, this is the platform you're going to use, so we all can become conversant in it and we could streamline our supports in it. We also had to say, here's how you're going to use that platform so that the educational experience wouldn't vary as widely from teacher to teacher and classroom to classroom and school to school, which was some way just part of decentralization. People who are closest to the school can make those decisions, but when we make those decisions, not even capriciously or maliciously, but make different decisions, They land on different families based on the baseline of resource that either we assume they have or that the system is created to function with. And that's what Dr. Harris was mentioning. I think the other thing, though, that was one of the byproducts of this, I saw a question in chat around how did school system respond. There were a couple things that we did, I think that being one of them, kind of saying, let's say, what are some givens across the system? Something that I didn't anticipate was going to happen was one of the tools that we use that I see a lot of teachers really taking to and making their own was a way for the teacher to be able to look into each student's thinking. So they might give an open prompt and they'd give them, I won't call it wait time, but work time. We're talking 60 seconds, maybe 2 minutes. And the teacher could literally look at every student's screen simultaneously and see what answers they were putting in, even if they weren't answering anything at all. What I saw was some students had time to think and to process. What I also saw, especially for the elementary school students, I won't speak to the high school students, but for the elementary and waving, they really loved being able to write in the chat and to interact and be able to ask questions. So in a classroom where only if it was the 4 of us raising our hands, say, ooh, pick me, now you're having a process where kids can be heard more clearly. And it's not as, say, chaotic as a bunch of raised voices, but you can kind of see who's digitally raising their hand, who has a particular type of question. I can see that Dr. Anderson could have a particular challenge because I'm seeing her response to the question, and I can follow up and ask her either to volunteer what she shows she knows, but might be a little bit more humble to share, or I can recognize the challenge she's having and lift that up, and I can see where there's a shared challenge that's across the system. I saw, for the context of our conversation, I saw a lot of girls being able to thrive, say, in mathematics in that way, because now it wasn't the same press and pace for attention, but it was able to slow down the game, if you will, for those who are sports aficionados, to say, okay, now I can think at my own pace, I can participate at my own pace, and I can perform at a high level at my own kind of way of working. And I think that was an unanticipated thing. I think a big thing, though, that I'm sure Dr. Harris, Dr. Anderson, yourself saw was there were all these things that we could just never do as our system. You can't ever give computers to kids. So, for example, we were 1-to-1 grades 3 through 12, but the devices had to be used at school. They could not be used at home because the prevailing thought was students would not be able to keep them safe, keep them operable. Within 24 hours, we had to figure out a way how to deploy over 80,000 devices. And we've seen now over a year that students actually can be trusted from all types of backgrounds to maintain their device, to manage their device, to ask thoughtful questions, to get them repaired when something inadvertently goes wrong, because a 7-year-old is still a 7-year-old, just like a 14-year-old is still a 14-year-old. Things happen. That computer screen got cracked. Don't know how. Won't ask any questions. We'll just replace it. We couldn't all the things that we as a system said, we can't do that. It was amazing what we could do when we put our minds to it and our community supported us. But I think those are some of the things I saw happening that were unexpected, just how this allowed some students. But here's the other thing I think a question was asked is what were some of the challenges? What I see is that we're seeing across the country, but in Charlotte-Mecklenburg schools as well, an increased course failure rate. The number and percentage of students who are getting D's and F's is up dramatically. But what I'm seeing across our data is a lot of students are experiencing course failure, not because of an lack of capacity, meaning aptitude, but the idea of what I think Dr. Anderson was mentioning around self-management and independent learning. Managing, turning in your assignments, turning them in on time, turning them in through the way they need to be turned in. That those little self-management or soft skills, I think that Dr. Harris mentioned, those show up in that. So it's not the students all of a sudden, they just aren't capable, but we were supporting so much of their functioning that when they had to function independently, especially in early adolescence and middle school and high schools, and they're managing multiple classes and multiple teachers and multiple expectations, that self-management stuff that we weren't attending to, those soft skills, are showing up in how kids are performing in classes. And those are some things I think we're going to have to invest in. How do we develop that? There's some programs that some of our teachers use called AVID, which helps develop that, but that's not something that we've instituted across every middle school or every high school. So there has to be ways we build self-management, independent learning skills along with some of these digital skills that our doctors have mentioned.
So you brought up so many things for me there. I want Dr. Harris to mention a very practical thing that was done when you were concerned about children just in the inequity of their backgrounds or feeling a little bit insecure about taking part in some of your programs. Can you share for everybody what was done at Junior Achievement?
And what we did at Junior Achievement for our team, our education team, was created a virtual background or told students to use, for high school students, to use a blurred background to just so that there's not a distraction in the background, like checking out people's kitchens or looking at, what's going on or who's walking in and out. Because what we found, and it was, this cohorts that we were working with the high school students are very small, but what we learned, even in a meeting with adults, is that it is a distraction. You're looking around, you're looking behind at what's behind it and what's going on. And oftentimes I felt like that's why students were turning their cameras off, because they knew and they wouldn't connect to the sound because they knew what was going on in the household. And then when we're having a discussion, is often a distraction. So that's what we did. We created virtual backgrounds, or we told students that they could use virtual backgrounds. But we started when we came onto the screen with having our backgrounds all the same with our name and that. And actually we kind of got lead from Girl Scouts. So my daughter's a Girl Scout, and their first batch that they got was around digital hygiene and digital security and internet security. That was the first badge that she got when they switched to virtual. So, talking with students about not sharing their last name or even what school they went to, because the students were from different schools in CMS, is the first line of, digital hygiene, of saying, don't share. So when you come on, you just say what grade you're in and your first name with your last initial. And the same thing happened with all of our volunteers, is really trying to create that digital etiquette to understand that, have that equity, but that digital privacy and equity built into all of the programs that we manage.
I want to address a question in the chat. What's being done or can be done about burnout? And this is a recognition that it's not just children. I think I've heard that there's some companies that are even limiting the time of their Zoom meetings because they realize that sometimes while some folks love to sit on screen for hours on end, for others it's tiring. And so how do we accommodate individual learning styles that may need that moment? I think the question is asking, students and teachers, like many of us, are zoomed out. Some schools have asynchronous days to allow students time to work at their own pace and really have a bit of a break. So, Dr. Anderson?
I would love to address this because one of the things that Zoom fatigue is a real mental health issue. And if we're thinking in terms of just prior to us moving into virtual schooling, the push was for children to not have as much screen time, right? And you don't want them to have more than 30 minutes. You want to make sure that you're limiting how much time they spend in front of the screen. And now we're requiring them to have an entire school day in front of a screen. And we're not necessarily recalling some of the cautions and the warnings that we are giving about screen time for children and the impact that has. And then also that as the teachers, they have very learning styles just as much as the children do. And there are teachers who get just as overwhelmed with all of the
Oops. I think we lost Dr. Anderson.
the screen time and the faces and trying to figure out what's going on in every single screen, just able to have simple things like breaks, S's, all of these things are helpful for making sure.
I think we lost her there for a second.
That the students.
Great. I will say that even for myself, I realized that there were some natural breaks in the workday where you might get up and walk down the hall, to speak with someone, or that were just, I realized in the first couple of weeks of working from home that I was getting just, you're glued to the seat and you don't take those natural breaks that sometimes really help you to continue moving forward. Dr. Barnes, can you talk a little bit about, because I know this has come up at numerous school board meetings from parents who have been concerned about the amount of screen time, just what's being shared with teachers about giving some variety to the school day, while also, I know you're very well aware of all of the requirements that CMS, just like every other school district across the state, the requirement of hours and time on task that you have to meet as well.
Well, it varies from grade span. So the difference in expectations varies from K-5 or pre-K-5, 6, 8, and 9, 12. We try to be able to mix things up. I think some of that also is just how you use this particular modality. Some of our teachers have become very adaptive, being able to breakout groups, whether it be triads or turn and talk in small groups, to be able to provide that. I think it's also being able to structure the day for particular breaks and using that asynchronous instruction, and being able to either integrate that in a particular day, say on a Wednesday, the middle of the week, to have asynchronous learning so people can kind of get a break during the week, or using asynchronous learning during the school day. But I think as we compare our experience in the spring to currently, there's also a difference in expectation that Dr. Anderson alluded to around what the instructional experience should look like. And in the spring, it was okay for a student to only be on 90 minutes and to be the majority of their time be asynchronous, or we'll call self-directed. As we've come back in the fall, that's no longer the expectation. And so I think the Zoom burnout for adults and for students is real. I will say, because of where I sit centrally, we always are thinking about our students. However, I do worry equally about our adults, and that our teachers are further isolated. Our teachers are spending just as much time in front of the kids as well as on screens preparing a thoughtful lesson. They're also communicating with families on screen. There's a lot of increased tension and stress on them as they're managing homes. As you saw, the Zoom struggle is real. Dr. Anderson is a nationally recognized leader in her area, but she's fighting for bandwidth in her home as other people are attending to their needs. Our teachers are having those same kind of experience, making sure people are fed. I worry about our teachers as much as I do our students.
I want to ask us all to reflect just a moment when we think about all of the disparities, not just technology, but other issues. But let's stay with technology, since that's what this panel is about, to think about the different sectors and how they address it. We're focused on schools today, and Dr. Barnes, I want to throw this to you, because I'm sure you think about it in your role often. There's an inequity here. Is it just for the public sector to address, or do nonprofits and other organizations have a role? Because this is a community issue. You touched on the delivering of meals, and that we know that there are students who receive breakfast and lunch, and that was a primary concern in the beginning, as well as keeping kids connected. But talk about the role that different groups will have to play to address this. And if we want our school districts to address all of this, then we do also have to look at funding, and also looking at really whether or not they have the infrastructure to do it. And I really appreciated yesterday when I was talking with Dr. Barnes, we started thinking about even the vaccine rollout. So it's great that you have, I'll say for our conversation, computers and hotspots, but you have to have the infrastructure, as you all talked about, to support everything. So that was a really long question, but let's go back to how different segments of the community address disparities.
I'm glad you asked it, and even the way you asked it is what I think all of us can acknowledge on this panel, and I'm sure the majority of the participants who are actively listening, is that there are disparities that preceded COVID-19 hitting the United States. And what we need to grapple with as a community of learners, intellectuals, and leaders is what role does the public sector have in bridging that gap between what is needed and what's acceptable and where families are? What role does the private sector need to play? And what role does even faith-based, community-based, or non-governmental organizations need to play? I think what many of us in our default role is we'll lean on the public sector to be able to meet these needs, but then recognize that do we build the infrastructure, give them the human, technical, fiscal resources to be able to bridge that gap? And so should any of us be surprised that when it comes to public schooling, that public schools are structured, created, and funded to be service deliverers? And that when they're put in a community that's vulnerable or historically underserved, have not been resourced or leveraged or even given the efficacy to be transformative institutions. We ask them to be transformational, but we fund them at subsistence levels. And we have to grapple with, if these disparities exist in communities and schools exist in communities, as well as all these other players in the role, including universities, what role do we ask each of these institutions to play, and how do we resource them to do so? One question that's been asked is about the skills of teachers to reach students digitally. Teachers, for the most part, receive their preliminary preparation at universities. What level of digital literacy is integrated into the curriculum of universities that license teachers to prepare them when they come in the districts, be them urban, rural, or suburban, or private or charter, to be able to deliver to students, as Dr. Harris mentioned, where there's a lack of resources and that the base is lower than what you might expect for the average resident in a community? We need to all look at how do we put our arms around families and neighborhoods and recognize that students don't come in nice wrapped packages, but they belong to families that rest in neighborhoods, that are part of communities, that are part of cities, even if those are rural cities or rural towns. So I think there's a lot that we have to think about all our roles, and not just look at one sector, the public sector, or one system, a school system, and say, hey, bridge this gap. One system didn't create these gaps. One system operating in isolation cannot close all these gaps.
I see both Dr. Harris and Dr. Anderson shaking your head, or nodding your head in agreement. Would you like to weigh in here?
Go ahead, Dr. Anderson. Okay, so I really quickly, and I definitely echo that after coming up in a school system in New York, having my child in Fort Mill school system, and then also being in CMS right now, just having a list of things that teachers need each year that the parents are contributing, wipes and paper and things like that. That list of things that not that your individual child needs, is that the parents are expected to give the teachers in the school what it needs in order to educate our students, or suggesting that we give those materials. But I go back to what we said about higher ed. If the higher education system doesn't prepare the frontline workers, which are teachers, then you have to have that remediation, right? That digital remediation. But to Dr. Anderson's point, it was because there was a resistance for technology. We didn't want it. We wanted the old-fashioned. We didn't even want calculators in the classroom. We wanted everything to be paper-based, the technology pushback from the education system. So to your point, Dr. Barnes, when are we going to shift our mindset to know? And we talked about this on the pre-call a little bit around being prepared when you can't be in the classroom, just having teachers prepared so that you don't have snow days in Rochester, New York, which you are allotted 10 a year. You don't have to have snow days. You say, hey, everybody has a device, take the device home. It's calling for a hurricane, so go home, and the teachers are prepared to act. And so there's more time on task. There's more time that we can just really quickly pivot now. And I think that should be every school district across America. Their teachers should be prepared now. There's no reason whatsoever that we shouldn't be prepared to go digital if we need to, for natural disasters, for pandemics. But the point is that, the teachers now that are coming out of higher ed just need to have that be just like equity needs to be taught, digital awareness, like all of those things need to be prerequisites for preparing the next generation of teachers that are coming out, because this is our reality and it's not going away.
And I think to add to that, being able to expand our view, and we address the holistic student, but if we look at this as a holistic community issue, we get to be able to tap into the skill sets of community partners a lot better. We instead of focusing on what this student needs, what does the community that surrounds the school, what are the needs that are there? And we'll see things in terms of those hardware resources that they might need, basic things in terms of food access. Is the school in a food desert? Do we need to address that? What is the percentage of mental health professionals in this community? And do we need to bring in resources there? Are there partners who are willing to come in order to support tutoring services? Where are the libraries? Do we need to have access to books? If we look at this from a holistic community perspective and just make it a little bit wider than the holistic student, we'll be able to see what some of these things are and the ways that we can address the opportunities and pull on the strengths of those around us, be it nonprofit sector, the public sector, whatever that might be, being able to pull all of that in to be able to build the community in a way that's going to be a little bit more fortifiable for the students that we're trying to reach academically.
Very good point. We do have a question. What support have you been able to offer students in homeless situations? And I'm going to let Dr. Barnes jump in here. I will share at the beginning in March, when the foundation was able to get our first set of hotspots, the first group that was prioritized were the students who were experiencing homelessness, and they received them as soon as they came in. The lead social worker was there to get them and distribute them to students. And Dr. Barnes, I'll let you add to that.
Sure, I think you summed it up nicely. I think we have an infrastructure to support our homeless students, but let's make no mistake that if you're homeless, school becomes a place where it creates continuity and consistency and stability and resources. And although we gave hotspots, we gave devices, we have social workers who specifically are allocated to support homeless students, I'm going to say it, those resources are insufficient for a family that is without a home, especially during a global pandemic. So we've been trying to support them. I think I want to recognize and say publicly that parents who are homeless love their children just as much as families who have homes. They're just as committed to their educational excellence, but the resources they have to be able to facilitate that are different, less, and those are challenges that our school system aren't set up to be able to make up that difference when they're not coming to a brick and mortar building. And I think it's those reasons why our board was so adamant that we needed to be able to get younger students into buildings, even in a rotation, so they could have that kind of resource. And I think our board was forward thinking and trying to push for that. But I would dare say that students who are in that level of vulnerability and their families are that level of vulnerability are going to need additional supports as we come out of this pandemic and we get back to a conventional society that's more open.
And I think that question is a great example of what we talked about earlier in terms of, is it just the public sector that's responsible for addressing this issue of homelessness? And then I think we can all agree it's going to take a much broader response. And Courtney put in the chat, yes, collective impact of all of us. Well, I'm looking at the clock and I was asked to end close to 10 till. Dr. Harris, Dr. Barnes, Dr. Anderson, thank you so much for being part of this conversation. I've really enjoyed speaking with all of you, and I hope that for our participants, we've given them some things to think about, because whatever space you are in, whether it's on the university level and you think about the way that teachers are trained, within the school district, we know there's new attention to just the digital literacy skills of our students. If you're with a nonprofit, that there really is work for all of us to do. No shortage of work and ways that we'll address the problems. I'm going to turn it over to Dr. Meggs now.
All right, I want to thank all of you. This has been a fantastic discussion, and I want to thank you for sharing your expertise and the ways in which we can help our students, and for everything that you shared. I think it's so very important that parents and teachers and educators hear about the ways that Charlotte-Mecklenburg Schools has helped. And the ways that we can see how we can help students in the future and how we can prepare as we move forward. So thank all of you for this very robust and productive discussion. Thank you, Dr. Anderson. Thank you, Dr. Barnes. Thank you, Dr. Harris. And thank you so much, Sonja, for being willing to moderate. Yes, 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 yes. This fantastic discussion. This was great. This was really great. And the thank yous are coming in. I see folks are posting online about it. So thank you so very much. And for those who are attending, I want to let you know that this is just a taste of the kinds of discussions that are going to happen when the Women and Girls Research Alliance hosts our summit in March. We are hosting our biannual summit, and the title of our summit, and we are co-sponsored by Ally Bank. It is called Recovery and Discovery, Women and Girls in a Dual Pandemic. And we are so excited that we are having this discussion now. We are calling for a community conversation. We are asking community persons, we are calling for teachers, researchers, we are calling for scholars, we are calling for students. We are asking everyone to join us and come together on Wednesday, March 10th, 2021, to come together and have a conversation around education, domestic violence, employment opportunities. We are asking you to help us as we look at the economic mobility of women and girls as we have this discussion. I believe UNC Charlotte is one of the only universities in the country with a woman at the helm as chancellor and provost, and we will be having a discussion with her as well as our Mecklenburg County Manager, Dina Diorio, to talk about what does it look like for women in leadership. They will be our inaugural women's leadership panel. So we are asking you to come to our website. You can register for free. It is an all-day workshop from 8 to 4 on Wednesday, March 10th, 2021. We will have some fantastic discussions. So join us on that day. We are kicking it off again. This is just a small taste of the fantastic discussions we will have that day. We are asking you to join us. We will have some wonderful giveaway prizes, robust discussions. We will also be featuring some of the research that the Alliance has sponsored. So come and join us and learn and add your voice, add your advocacy. The results of that day will help the Women and Girls Research Alliance to structure our focus for the next 2 years. So we are asking the community to lend their voice and guide our scholarship and research for the next 2 years. So we're asking for your input. Again, join us on Wednesday, March 10th from 8 to 4. This will be a virtual conference. So we're asking you to come and partner with us as we look to the future for women and girls. Again, I want to thank our panel today. You are wonderful, awesome, and marvelous. And I look forward to us having more discussions in the future. Thank you again. Thank you so much. Enjoy the rest of your day, and we look forward to talking with you again soon.